Hi, thank you for joining us on our Facebook Live today. My name is Carrie with Unity Point Health Finley Hospital, and I'm with Karen Gonzalez, who is our stroke coordinator here at the hospital. And we're here today to talk a little bit about World Stroke Day. So, Karen, tell us, what is World Stroke Day? Why are we even talking about this today?
Well, October 29th was designated as World Stroke Day by the World Stroke Association a couple of years ago. And it's a day to have people all around the world get some information, some facts, and some ways to learn about stroke and learn about ways to prevent stroke and to understand stroke a little better.
Great. So if we want to understand stroke a little bit better, probably the first question that comes to mind is, what is a stroke? What actually happens? Can you tell me a little bit about that?
Sure. So when a patient has a stroke or a person has a stroke, essentially a vessel in their brain has a blood clot that's preventing oxygen getting to the brain cells. It's much like a heart attack, and where the brain starts to have damage where the blood flow can no longer get. And the brain cells can be cells that provide your ability to walk or talk or swallow or, any of your functions. So depending on where it's at in the brain affects the outcome of your stroke. Approximately 1.9 million neurons or brain cells are lost every minute when a patient experiences a stroke. So it's really important for people to be able to recognize the signs of stroke and then to act quickly, because you might be preventing your death or a severe disability in yourself or someone that you love.
So speaking of prevention, does stroke affect anyone, or are there things that you can do to help prevent a stroke?
Sure. Well, actually about 80% of strokes are preventable, and they're as a result of some of the chronic illnesses that people experience. So about 90% of all the strokes that people have are called ischemic strokes, which means that a blood clot either forms somewhere in the body and lands in the brain, or it's from buildup of plaque that one day there's no more blood that can flow through. So some chronic illnesses that encourage a stroke are high blood pressure, high cholesterol, and diabetes. And often people have one or more of those at the same time, and so that just, each time you add one, you're increasing your chances for stroke. So the other type of stroke I wanted to mention is a hemorrhagic stroke, and that doesn't happen nearly as often. And that's when a vessel in the brain bursts because of an aneurysm that maybe has been present, or there's a weakness in a vessel and it bleeds. Unfortunately, that type of stroke generally results in death. So the ones that we really focus on are the ischemic strokes, because that's ones that we can prevent and also treat.
Great. So I've heard the acronym FAST. And that's in relation to kind of some of the signs and symptoms that people can watch for when they're having a stroke or a loved one is having a stroke. What does that FAST acronym stand for?
Sure. So the F in FAST stands for face, and you might notice someone suddenly having a drooping of their face. So a way to check that is to ask them to smile. And if you see an asymmetrical smile or some drooping, that's a symbol that they could be having a stroke. A is for arms. So someone might be experiencing weakness in their arm or complain of numbness in their arm suddenly, and you can ask them to raise their arms. And if a patient's arms or a person's arms are doing a downdrift, that's a sign that they could be having a stroke. S is for speech. So if you notice a patient or a person struggling with their speech, not being able to find their words, just different than you would normally have them, ask them to repeat a simple phrase. And if they're having trouble doing that or finding the words, that's a sign that they could be having a stroke. And T is for time. So time is of the essence, so we want you to call 911 right away. Use the EMS system to transport a patient to the hospital. Don't have them drive, don't you drive. We want people to get there as quickly as possible, because treatment is possible for patients, but time really makes a difference. So we tell patients, if you're having trouble speaking or having trouble walking or having numbness in your arm or leg, don't go to bed and see if it's still going to be there in the morning. Get the help right away, because if you reach the hospital within 3 hours of the time the symptoms start, there are treatments that can help you decrease your deficits. One thing I wanted to mention is if you witness a patient having a stroke, take note of what time those symptoms started and make sure that EMS has that time, because treatment depends on the time symptoms started, or what we call last known well, and treatment needs to begin within 3 hours of that.
That's really interesting. So what if I think I can get to the hospital faster than the EMS? Is there anything that the EMS people can do to help communicate to the ER that somebody's coming, or can I just speed through every red light and get here?
Well, that's a bad idea, but yeah, EMS is great for that because these are trained personnel. So when they look at your symptoms, they're going to be aware of, oh, this patient might be having a stroke. They call ahead to the radio head to the ER and say that there's a potential stroke. So what we do then is do a hospital-wide cold stroke alert, which puts everybody on high alert that we have a patient with possibly having a stroke. The CT scanner prepares for that patient, the lab prepares, everybody that plays a part in that care comes to the ER and is ready for the patient. So oftentimes, or most of the time, when a patient comes by EMS, they go directly to the CT scanner on the EMS gurney, which saves a lot of time, which saves a lot of brain.
That's awesome. Great. Well, you're very knowledgeable on this topic.
Thank you.
So thank you for sharing all this. But as a stroke coordinator, tell us about that. So you obviously know a lot about strokes. You know a lot about what the hospital does to prepare patients for care here. What's your role as a stroke coordinator?
So as a stroke coordinator, I'm pretty passionate about helping patients to get the best care they can get and have the best outcomes they get. So I'm involved. If a patient comes in having a potential stroke during the day, I go to the ER and I meet the patient, meet the family, try to keep them informed of what's going on, try to make sure the physician has everything that they need to support them and the nursing staff as well to make sure things go smoothly. And I work with the stroke team. So to make sure that we're up to par on all the newest best practice guidelines for stroke and that all of our nurses and physicians are educated on that. I also work with the team in preparing for our Joint Commission survey. We are a certified primary stroke center from the Joint Commission, and that means that we do provide excellence in our stroke care.
Awesome.
Yeah.
Is there anything else you would like to add today?
I just had a couple takeaways that I wanted to make sure people paid attention to. So remember that 80% of the strokes are preventable. So manage your high blood pressure, manage your high cholesterol and your diabetes. Take your medication. A lot of people don't think they need it, and about 1 in 4 Americans over age 65 don't take their medication as they need to. Eat a healthy diet. Try to be physical 30 minutes a day, 5 days a week. Don't smoke. If you do smoke, try to quit. There's lots of help out there. Smokers actually have twice the risk of stroke than non-smokers. Don't drink to excess. Recommendations are 2 drinks a day for a man and 1 drink a day for a woman. And know the signs and symptoms of a stroke and then act fast. Call EMS. And I think it's important to talk to your people around you and make sure they know the signs and symptoms because they'll be the ones that are watching for you.
Those are great takeaways.
Yeah, thank you.
So as a follow-up, if you'd like to learn more, you can visit our website, unitypoint.org. We've got information about our stroke certification, about our emergency room, and our primary care doctors who play a big role in managing chronic conditions that may help save your life from a stroke. So learn more at unitypoint.org, and thank you so much for joining us today. Thank you, Karen, for sharing such great information with us.
Thank you for having me.
Thank you.